Good morning, ladies and gentlemen. I'm Dr. Wilson of the Nuclear Medicine Unit at National Center for Radiotherapy and Nuclear Medicine at Korle Teaching Hospital, Accra. First of all, I'd like to thank Madame Florence Taylor for her initiative thinking about poor people and how to help them, and in the long run also help us to enhance our work at the Nuclear Medicine Unit. The Nuclear Medicine Unit is one of its kind in the whole country. There are plans to establish another unit at Kumasi, but that one has not been set up yet. And in the future, there are plans to set up a whole radiotherapy center at Tamale as well, so that patients don't have to travel too far to come to Accra for these services. But until then, this is the only place where you can access these services. Patients who come here fall into different categories. Breast cancer patients, cervical cancer patients, prostate cancer patients. Most of the time, in order for the doctors to properly manage a patient, they need to know if the cancer has spread from the primary site or not. And the only way to do that is to do a bone scan, so that a bone scan will determine if the cancer has spread to the bones or not. Most of the prostate cancer patients who come here are people over 50, or most of the time even 60, 65. So it means that these people are economically a little distressed, and the cost that they go through for the management of their problems can be prohibitive. Before they come here, a lot of them would have done simple tests like PSA, biopsy in the Department of Pathology, maybe some CT scans, and this is more like the test to determine whether the cancer has spread or not. So the doctors need to know before they start treatment. And we are the people who provide the service in this hospital. I've been with this unit for close to 15 years or more. And my experience with patients is that most of the patients who come have difficulty meeting the payments that we charge here. And even the fees that we charge are subject to foreign exchange fluctuations of the local currency. And right now, we are even thinking of increasing the fees by another 10% or so that we can sustain the service for others to come and enjoy it at another time. But most of the patients, or quite a number of problems with meeting the cost of the service. And it is in this regard that I appreciate the help that Madame Taylor with the charity is trying to help these patients. Normally, you do the bone scans once a month because of the demand, which may not be very high. So patients normally have to wait for a while before they can get the service. But even when we do the scans, some of them have to delay their test because they cannot afford the fees that we charge. And there are instances where we have to go back to the previous bookings and look at how many patients are booked for a long time but have not had the service. And then we call the patients and ask them, what is the problem? And if it is a matter of money and we can help, we ask them to come and then we do the service for them free of charge. But we cannot continue to do that for a lot of patients. So it is always helpful if we can get somebody else to support the patient so that they can pay for the cost of the service. Yeah. So we see these patients, but before they get to us, they would have paid some fees along the way. And from the diagnosis of the disease to the end of the treatment, a typical patient will have to pay something like 15,000 Ghana cedis. Now 15,000 Ghana cedis is about how many well, at the current exchange, I forgot the exchange rate, but it's about 5,000 to, so it's about 3,000 pounds. Yeah, it's about 3,000 pounds per patient. For a lot of people, this is not something they can easily afford. So we are very grateful if we can help some assistance along the way for the patients before when we go for the biopsy and they do the CT scans. They come here for the bone scan, and then from here they have to go for the radiotherapy, the external beam radiotherapy for a period of a month with some medication along the way. Some of the medication is quite expensive here. Zoladex, for instance, is over 1,000 cedis per injection, and some of them have to take about 6 of them or 8 of them during the course of their treatment. And some people start and then they stop, which means that it's not a good way to manage a cancer because it's ineffective. So we are grateful if you could, Madam from Taylor's charity could help the patients. So right now, what the needs that we have are, first of all, having a way to assist these patients who cannot pay for the services. We also need some equipment in this unit. Something like a gamma counter, automatic gamma counter, multi-well counter, which you can use to do some of the tests that the patients do elsewhere, like PSA for the patient. A camera, if we can get one, because that's an expensive item. Those calibrator or servo meter, stuff that we can use in the unit to enhance our work, because the problem we have is that usually once we buy one equipment, it's very difficult to replace this equipment, because if you don't get the subvention, you don't get the money from the source, national authorities. I've already prepared a list for Madam Taylor in regard of this particular problem of our equipment. So I hope she will show the equipment to you, and whatever you can do to help you will be very, very appreciative of your assistance. In connection with this assistance, we'd also like to increase the awareness of prostate cancer in the population. Most people are not aware of prostate cancer in this country, and we'd like to help, start an cancer awareness program. And tie it in with the breast cancer awareness program, so that people will know what to do, the sort of test that they have to do in order to be diagnosed for the management of these diseases. Because a lot of the patients come when the cancer has really spread, and the cost of treating it is high for them, and also for us, it becomes difficult to handle those patients. In conclusion, I would like to thank Mrs. Florence Taylor for thinking of this charity. Mrs. Taylor came to this in a kind of roundabout way. A relative of hers came to this unit, and through conversations of that relative with other patients, he realized the problem confronting a lot of these cancer patients. So when word got to Mrs. Taylor that this is what is going on, she decided that she would like to do something to her. But for that, I'd like to say that we are very, very grateful, first to the patients, and then to the unit, so that the unit's work can go on as we care for these patients. Thank you very much. And to the audience, I'd like to say thank you for any help you can give us. Thank you very much. God richly bless you.